Good evening and namaste from the amazing city of Goa, India. And welcome to India's first low-carb conference organized by Shashikant Iyengar, India's most certified and SMHP accredited metabolic health coach, in a joint initiative with the founder of India's only low-carb and award-winning platform, DLife.in. This evening, I have a very special guest with me, Dr. Ken Berry. Hello, Dr. Berry. I think you're on mute. Yeah, needs to be unmuted.
All right. Sorry about that. I'm with you now. Thank you for having me.
Yeah. So I will just introduce you for the benefit of those who have not known you, but I think that's very unlikely. Dr. Ken Berry is an MD, a family physician in Tennessee, and is affiliated with the Henry County Medical Center. He received his medical degree from the University of Tennessee College of Medicine. He's the author of the bestseller, Lies My Doctor Told Me, which exposes myths and misleading health advices from well-meaning doctors, such as avoiding fats and red meat. He also has a very popular YouTube channel by the name of Ken D. Berry, MD. Dr. Berry's own health dramatically improved when he embraced a ketogenic diet, and he's one of the most powerful voices now on low carb and especially on carnivore. Welcome, Dr. Berry.
Thank you so much for having me. It's a pleasure to be with you guys this morning here, this afternoon there, and I'm happy to answer any questions you guys might have for me.
Yeah, my pleasure to ask you a few questions. Although 1 hour seems too little, and I'm a big fan and a big follower of yours, I would love to have more sessions, but let me just kind of rush through, the basics at least. Dr. Berry, please tell me, being a mainstream doctor, how did you come into low carb?
Well, the way I discovered low carb is that I became very obese and pre-diabetic. Okay. And when I discovered that process going on in my own body, I started following the American Diabetes Association recommendations very carefully, because before that I was just eating whatever junk I could grab, because I was very busy working in the emergency department of several local hospitals and also my full-time clinic. And so I didn't have time to really think about it. But when I developed prediabetes and became severely obese, I thought, this is disingenuous of me as a doctor to be obviously obese and obviously metabolically unhealthy, and then go into patients' rooms and counsel them on how to be healthy. That didn't feel very genuine to me. And so I thought, I need to fix my own health if I'm going to counsel other people about their health. And I tried the American Diabetes Association diet, and I actually gained weight and became more pre-diabetic. And it was at that point I thought, well, maybe I've missed something here. And so I really started digging into nutrition research and reading alternative hypotheses about what causes diabetes and obesity. And in the process of that, I discovered primal diets, paleo diets, low carb diets, and then ultimately a ketogenic diet. And then now ultimately for the last over 5 years, a carnivore diet. And that journey is what completely reversed my prediabetes and completely reversed my severe obesity. And they both went away. It's almost like my body knew exactly what to do when I stopped feeding it the high carbohydrate, slow poison food that's recommended to most of us, if not all of us, and started eating the ancestrally appropriate food that was full of animal fat and animal protein. That's where my body seemed to thrive the best. And when I started recommending that to my most severely obese patients, it worked for them as well. And so that's when I started delving into anthropology and paleoanthropology and archaeology, because I thought, it's probably very important what our ancient ancestors ate, because they are us. We came from them. And so we should probably try to mimic their diets. And when I delved into that research that most doctors never read, I found that it's very well known and very well understood that before about 10 to 12,000 years ago, everyone ate fatty red meat. They ate meat. They ate seafood. daily if they could get it. That was the go-to food. That was the optimal food for human health and human reproduction and human longevity. They knew to eat the meat. They knew to eat the organs. And it's only with the agricultural, I call it the de-evolution, but some people call it the agricultural revolution, we started to subsist on different grains and different beans and legumes and peas. And we can see very clearly in the anthropomorphic data that we got shorter, that we got less healthy, our bones became weaker, our dental health suffered greatly, our brain size actually shrunk when we all adopted a beans and rice diet, a grains and legume diet that was very unhealthy for us. And so that's kind of my backstory of why I'm here and where I came from.
Yeah. Oh, that's amazing coming from a mainstream doctor. I mean, that's mind-boggling. Thank you for that. And Dr. Berry, you've been the biggest proponent, or let me say, you have used the term proper human diet. Tell us something about it. Are you implying that what we are currently eating as a species is not the right diet or is not the proper diet? What does that imply?
Yeah, absolutely implying that. So I wouldn't be boisterous enough to use a term like the proper human diet if I didn't think that there was substantial research in multiple fields of study to back that up. And indeed, when I was first recommending a keto and a carnivore diet to my patients and to people online, I had never used that term. But the more I delved into the anthropology and the archaeology and the paleoanthropology, it became self-evident that there is a proper human diet, and it is a spectrum of diets. Okay, it's not just carnivore, it's not just keto. I think that very many people on the planet, depending on their DNA, depending possibly on their gut microbiome, depending on their age, their other health issues, they need to eat somewhere on a proper human diet spectrum. And so a proper human diet avoids all sugars, both definitely added sugar, but many of the naturally occurring sugars, if you eat them daily, it's going to cause weight gain. It's going to cause your blood sugar to be too high. A proper human diet contains no grains whatsoever. And I know for many people, they're like, wait, no, my doctor told me that rice or wheat or millet or amaranth or sorghum or rye or sabudana, is that right? Or nachini or barley. These are healthy. They're full of vitamins and minerals. When in fact, nothing could be further from the truth. They are devoid of the main vitamins and minerals that you need, and also of the amino acids you need to build proteins. And in many cases, they contain a large quantity of anti-nutrients that keep you from absorbing any vitamins or minerals that they may contain, and also can lead to quite a bit of inflammation, either in the gut or in the joints or in the skin, or it can manifest as mental health issues, anxiety, depression, and other mental health issues. Grains are a fallback food. Grains are a starvation food. And so I tell people all the time, if you're literally on the verge of starving, then you should eat all the grains and all the beans, because they will keep you from starving. Absolutely. But if what you're trying to do is optimize your health, grains and beans and legumes, they play no part in that. A proper human diet is nutrient dense. That's the reason we eat food, is not for calories. We eat foods so that we can get all the amino acids to build protein and all the fatty acids that our brain and body needs to function optimally. We eat to get minerals and we eat to get vitamins. That's why we eat food. Well, many people eat food for pleasure, and that can lead to problems. Many people eat food because they think, oh, well, my doctor or dietitian said I should eat more amaranth or millet or quinoa. And that's not based on any meaningful research in any field of study. A proper human diet by design is low in carbohydrates. So there may be some people who believe in a vegetarian diet, and I think for many people that's fine, as long as you're including eggs and seafood and at least butter from dairy in your diet. I think that if you focus on eating the lower carbohydrate vegetables and you avoid all the grains and all the sugar, a vegetarian diet with no more than 100 total grams of carbohydrates a day and plenty of fish and plenty of butter or full fat cream and plenty of eggs with the yolk, always with the yolk, then I think for many people that's a beautiful diet. People think, no, wait, eating rice, wheat, millet, amaranth, sorghum, that's part of my heritage. That's part of my tradition, my family tradition. And here's what I would say to people. If you go back 100 years, yes, that may be true. But if you go back anywhere from 300 to 500 generations, then regardless of what your religion is currently, regardless of what your family tradition is now, if you go back 300 to 500 generations back in your family tree, all of your grandmothers and grandfathers were eating meat as often as they could, as often as they could find it, as often as they could kill it. Meat is the ultimate ancestral food. Homo sapiens sapien, that's what human beings are, have been eating meat for just as long as they have been breathing air and drinking clean water. That is how ancestral red meat is in the human diet, regardless of what your ancestry is, regardless of what your religion is, regardless of what country you live in. If you go back far enough in your family tree, all of your people ate meat as often as they could eat it.
Yeah, thank you. I just heard you mention sabudana. In the Indian context, Dr. Berry, carbs form almost 50 to 60% of the plate. I mean, that is considered food. So either you're eating rice or you're eating roti, or you're eating things like sabudana even during fasting. So that's quite relieving to hear. The fact that you gave about how carbs should be used and what you can do to get closer to the proper human diet in the Indian context, where most people are vegetarians. Do you think in today's metabolic health context, the proper human diet becomes all the more relevant because we are dealing with a series of metabolic epidemic, and that's how close we could come to finding remission if we understand the proper human diet better? So
Yes, absolutely. I think the degree to which we have ignored a proper human diet is the degree to which we develop metabolic disease as an individual, as a group, as a society, as a country, as a species globally. If you can read the works of Weston A. Price, a dentist who traveled the world looking at kind of secluded ancient populations of people. Anytime they ate grains, they sprouted the grains, they roasted the grains, they fermented the grains. Anytime they ate soy, it was always fermented, right? They knew that they needed the nutrition from grains because they couldn't get enough meat, but they never just ate the soy. They never just ate the grains. It was always fermented or sprouted or in some way treated to decrease the anti-nutrient content and the inflammatory nature of grains. And you mentioned the Indian subcontinent, and I've become a very big armchair student of archaeology and history. And when you look into the history of India and the British colonialism and basically the subcontinent of India was a slave to the British Empire, if you just want to use plain words about it. And so in any slave population, they're encouraged to eat the grains. They're encouraged to eat the beans because the slave owners, the masters, they want all the meat for themselves. And so there are multiple examples in Indian history, which I'm not an expert on, but I've read enough about it so I can see the broad outline. The Indian population was subjugated and was severely mistreated by the British Empire. And the British Empire basically raped the Indian subcontinent. And they left the Indian population with the grains and beans because that's what any dictator, that's what any slave owner feeds to the slaves is grains and beans, because it's the cheapest food you can feed them that they won't starve to death. And so for many people, I've spoken with many people who live in India, and when they start to read the history and actually realize, oh no, wait, 500 years ago, we ate meat all the time. And then if you go back 1,000 years or 10,000 years, everybody ate meat every single day they could get it. It was not part of a religion. It was not part of a caste. It was not part of any of that. Everyone ate meat as much as they could get their hands on. And I think so many people in the Indian society, and I speak as an outsider here, just someone looking in, so many people are deluded by the misteaching of the British Empire. They're basically, they've been tricked by the colonial power of the British Empire to think that, oh no, beans and rice, that's my ancestry, that's my heritage. No, it's not. That's the slave diet you were fed, because that's all the British Empire thought you were worth.
Correct. I think I resonate with you because this has been part of the history, and I recollect reading it exactly the same thing. Because grains are a cheap, very cheap source of energy, or carbs are very cheap source of energy. So meat was largely reserved for the so-called elite people. While and also that agriculture is a recent phenomenon, like you said, we've been eating meat for the longest time, maybe since as long as we existed, because there was no agriculture there. So I quite resonate with that. Dr. Berry would like to ask you as a next question, um, how did you decide to become a carnivore? I mean, there are various ways to do a low carb. There could be keto, there could be, in the Indian context, ovo vegetarian,
Yeah.
How did you decide to go carnivore? And you've been one of the biggest proponents of carnivore. In fact, I started my journey on carnivore after I started following you. And I myself was a case of membranous nephropathy of the third stage. And I reversed my condition by going fully carnivore. So I'm quite thankful that, I found you. I would like to know from you why you went carnivore.
So as I was adopting the low carb lifestyle, I was losing weight. My hemoglobin A1C was coming down when I adopted the ketogenic style. So if you think of a Venn diagram, then low carb is this big circle, right? And it still needs to not include grains and not include sugar and not include vegetable seed oils. But then if you decrease the carbohydrates even more, that becomes a ketogenic diet. And then if you decrease the carbohydrates even more, that becomes a carnivore diet or a ketovore diet, right? And then if you decrease the carbohydrates as much as you possibly can, that's a carnivore diet, just meat and eggs. And so a carnivore diet is actually a subset of a ketogenic diet. It's a subset of the low carb diet. It's just the lowest carb version you can possibly eat. And for many people, it's also the least inflammatory diet that you can eat as well. And so many people with chronic kidney disease, with glomerulonephritis, with polycystic kidney disease, when they eliminate all the plants from their diet, that's the thing that causes their kidney health to improve. That's the thing that makes the kidney condition go completely away. Not counting any permanent damage that was already done by the improper diet. Their kidneys now have a chance to heal, and their kidney function invariably increases. It improves on a carnivore diet. Now, I don't think everybody needs to be a carnivore, but I think everyone would benefit from doing at least 90 days of carnivore. It's the ultimate elimination diet because you're eliminating everything that's potentially inflammatory. You're eliminating everything that would potentially raise your insulin level too much, that would raise your blood sugar level too much. And so I don't think everyone needs to be a carnivore. I think some people can be an ovo-lacto pescatarian and do great if they're eating low enough carbohydrate vegetables and avoiding grains. But some people like me, I tend to fatten very easily, unlike most people in India. Most people in India can just live on sugar and grains, and they'll have tofu, which is thin on the outside, fat on the inside. And so just looking at them from across the street, you think, well, that gentleman or that lady looks very healthy. They're very slender. But when you check their fasting insulin level or their A1C or their inflammatory markers, you find out that they have a lot of visceral adiposity. They have that little belly pooch, right? Even though they're very slender, their A1C is a little high and their fasting insulin is very high. And so even though they appear outwardly to be slim and healthy, they're actually metabolically very ill. And only with checking certain labs that many doctors don't check, like the fasting insulin or a C-peptide, you can't find this metabolic disease. If you just check a fasting blood sugar, that may be normal. But you've got to go deeper and check more labs than many doctors are willing to check. And so that's how you uncover that. But a proper human diet absolutely includes the carnivore subsets. Everybody would benefit from 90 days, but not everybody needs to be carnivore for the rest of their life.
Thank you. Dr. Perry, can you, this seems to be some confusion for a lot of people as far as keto and carnivore are concerned. Would you just clarify if one can be on keto while being a carnivore? How is that possible? Is that possible at all or no? And what kind of people do you usually see in your practice who benefit mostly from these two protocols?
So you can absolutely be in ketosis for the majority of the day if you're eating a carnivore diet. The way you get into ketosis is to lower your carbohydrate intake. If you lower it down to 20 or 30 total grams of carbs a day, that's a ketogenic diet, and you're going to be in ketosis for most of the day. If you lower it even more, that's carnivore, and you're going to be in ketosis for much of the day. Now, a lot of people get confused about this. They think carnivore and keto are two different things, where actually carnivore is a subset of the ketogenic diet. And I've had discussions with multiple PhD human metabolism researchers like Professor Ben Bickman. And they say, by definition, you're on a carnivore diet, it's the lowest carb option there is. You're going to be in ketosis for most of the day. You may not be in what some people would consider deep ketosis, but you're still going to be in ketosis for much of the day. And you're going to be able to derive all the health benefits from that. The people who are going to benefit most from carnivore are people who want to lose excess fat quickly, who want to lose visceral fat quickly. It's a godsend for people with autoimmune conditions or with gut conditions like irritable bowel, Crohn's disease, ulcerative colitis. It absolutely makes those conditions either go completely away or go into complete remission where they have no symptoms whatsoever. People with severe reactive arthritis and autoimmune arthritis, rheumatoid arthritis, psoriatic arthritis. These people notice on a carnivore diet, it gets drastically better. And so many people who are they start out wanting to do carnivore for 90 days just for the elimination diet aspect. They feel so good at the end of the 90 days that they're like, I'm just going to keep doing this. And that's how I came to carnivore. I was very strict keto. And I kept hearing about Sean Baker, your previous guest. And so on my Facebook page, I said, hey guys, let's do 90 days of carnivore. Let's just see what happens. And all my adult life, I'd suffered from severe gastritis and reflux and heartburn. Took 2 Nexium every day, like 2 Prevacid every day, 2 Prilosec every day to control the symptoms. On keto, it was 80% better. I could just take a little over-the-counter something every now and then for it. But after that month of carnivore, it dawned on me I have had 0 heartburn for the last 30 days. And so that was kind of a wake-up call for me that maybe carnivore is the way for me. And so I just kept doing carnivore. I kept tacking on another month. And now it's 5.5 years. And in 5.5 years, I've went from having severe daily constant heartburn that was so severe, it would interfere with my ability to speak. I would have a hoarse voice, have to clear my throat. Now on carnivore, I have not had heartburn, reflux in 5.5 years. I don't take anything for it ever. I never wake up with heartburn in the middle of the night. It doesn't matter what spices I eat anymore. I can eat all the spices and all the herbs. They don't cause the heartburn as long as I stay on a carnivore diet. So there's so many people who are just at their wits' end. They're suffering very, very severely, and they think there's no hope. And they've tried every little foolish fad diet there is, and it's only when they try carnivore that their eyes are opened,
Yeah.
that their body wakes up and begins to heal. And that's why, I tell anybody, if you've tried all the different diets that your doctor recommended, that your dietitian recommended, that your religious leader recommended, and you're still suffering from these chronic inflammatory health conditions, try 90 days of carnivore, and you may be very pleasantly surprised at the results.
Yeah. I think I quite resonate with this answer as well, because my autoimmune was cured. Although I started off as finding remission to my condition. But I think by the end of the journey, I was so hooked on to the magic that carnivore created in my body. It totally reversed my autoimmune condition, and wherein the doctor had told me that he may, take me for a kidney transplant. So I was at that stage, and it reversed on a full carnivore diet. So I completely, agree to that. Dr. Berry, tell me, in India, as we understand, you may be knowing about it, the scene of vegetarianism is very different from the West, where vegetarianism in the West is usually veganism. But in the Indian context, there are vegetarians who are ovo-vegetarians, ovo-lacto-vegetarians, or pure vegetarians as well. What do you think is wrong with a fully plant-based diet, if at all? Why is that a problem?
Well, if your plant-based diet, your vegetarian diet, if it includes grains, then you're going to have all the problems we talked about previously. Grains are not part of an optimal human diet. They're not part of a proper human diet. Neither are beans or legumes or peas. These are not soy. That's not part of a proper human diet. That's the starvation diet that you were taught was your heritage. I think that there are many people who will do just fine on an ovo-lacto vegetarian diet. And I really, really wish that they would include some fish in that, some small cold water fish that live on algae or plankton, because those fish are so nutrient dense and they're so ancestrally appropriate that if they were an ovo-lacto pescatarian, I think that the predominance of their diet could be vegetables, not grains, not sugar, but real vegetables. And then eggs with the yolk, always with the yolk, some butter or ghee, and then fish once or twice a week. I think for many people, that's going to resolve so many health problems for them. And I think it's perfectly doable for probably most people on the Indian subcontinent, but I don't think it's appropriate for everybody. I think everybody can start there, right? And then if you're still having health problems, then you probably need to tighten that up more from low carb to keto, and still include some very low carb keto friendly vegetables, but increase the amount of the fish and the eggs with the yolk and the butter or ghee, and see if that doesn't resolve the condition. And then I think some people, even from the Indian population, you're going to have to be carnivore if you want optimal health. And so there's this concept in medicine and nutrition, human health, called the normal distribution curve. And this is every scientist knows what that is. So there may be some people over here who could do low carb, ovo-lacto pescatarian and have perfect health. Most people are going to have to get down to 20 or 30 total grams of carbohydrates a day for optimal health. Then there's a few people over on this end of the curve that are going to have to be ketovore, which is 10 total grams of carbs a day or less, or carnivore in order to enjoy optimal health. And so many people out there don't even know when I say optimal health, they don't even know what that means, because they've been so sick, so miserable, so fatigued. Their brain's been so cloudy and foggy, they can't think straight, that they get used to feeling that way. And they're like, I guess I feel okay. I don't know. I guess this is normal. The only way you're ever going to know what's normal for you, what's optimal for you, is if you do the 90-day carnivore challenge and do just carnivore for 90 days And then at the end of that 90 days, if you're like, I don't feel that much better, I felt just as good on Ketovore or keto or low carb with no grains, no sugars, then okay, good. Go back. Then you've got this spectrum, don't you, Ira? You've got a spectrum to choose from, and you can say, okay, I'm going to try 90 days of carnivore. And if Dr. Berry's right, then great. If he's not, I'll go back to keto, or I'll go back to low carb, ovo-lacto pescatarian, and I'll stay there because that's where I felt best. And either way, you win and I win because you're eating a proper human diet. You're not being tricked or misled by a previous colonial power or by a multi-billion-dollar multinational food corporation.
Correct.
You're not being misled and tricked and fooled. You're actually experimenting with your own body, your own physiology, and saying, no, I tried that diet. I was sick and miserable the entire time. But when I tried this spectrum of a proper human diet, I felt amazing. That's your body telling you that's where you need to be, and that's where your diet needs to be.
Yeah. So what are some of the commonest, because in India, as you said, you're talking about adding fish, but here that's an issue because vegetarianism means no meat, not even eggs. So people do not admit there can be or there are deficiencies on a fully plant-based diet. Could you expand on it a little more and tell us about the commonest deficiencies that are found in the Indian context if somebody is eating a fully plant-based and a grain-based diet, and how likely is it to occur, and why people on a carnivore diet are better off in terms of metabolic health, in terms of healing faster, energy-wise, and everything else, the difference between the two spectrums.
Yeah, there's a long list of possible deficiencies you can develop on a strict vegetarian diet.
Yeah.
The most common by far are vitamin B12 deficiency and iron deficiency. And I think iron deficiency is quite a problem in the Indian population. And then not to mention iodine, vitamin D, vitamin K2, vitamin A, vitamin E. All of these things are found predominantly in animal-based foods. And so people who are eating a predominantly plant-based diet are either not going to be getting access to these nutrients at all, or, as I said earlier, especially in grains, there are anti-nutrients because the plants do not want you to eat their seeds because the seed is their reproductive organ. That's what will keep that species from going extinct. So they put all kinds of phytochemicals and anti-nutrients in there. And so when you look up on a food database, how much of this or that or the other, how much of this vitamin, this mineral are in rice or wheat or millet or amaranth or sorghum or rye, it might say a certain amount, but very often your body cannot access that vitamin or mineral because of the anti-nutrients, the lectins, the phytates, the oxalates, the saponifins, the phytoestrogens contained in that. And so even though it's in there, maybe if a chicken ate that grain, its digestive system could get that vitamin or mineral out. The human digestive system doesn't have access to that because of the anti-nutrients and the phytochemicals. And so I understand that, people make decisions based on religion or based on what they think is their family heritage or what they think is their culture. But in so many cases, in America and in India as well, what we think is our heritage or our culture is basically just what our grandmother was taught by television commercials or by magazine articles. And she thought, oh, okay. And then she started cooking that way. She taught your mother how to cook that way. And then you grew up eating that way. Now you think that's your heritage or your culture. You think that's the right way. But in many, many cases, it's a complete delusion. It's a trick that large corporations, they're trying to make billions of dollars, and they don't really care about the health of your grandmother or your mother or you. They just want your money, right? And so, but many people, many grandmothers and mothers, they believe what they read in the newspaper. They believe what they watch on television. They think these people would never trick me. These people are my friends. I can look up to them and respect them and trust them, when in fact that is not true at all. Your health will suffer if you fall for these pseudo cultures, these pseudo traditions that are really, if you look back in your family closely, you'll find they're only 5 or 6 generations long. Before that, nobody in your family ate that ever. That was a trick that your great great grandmother fell for, or your great great grandmother was starving to death because she was living in a political climate where she had no power. She was effectively a slave or a serf or a peasant. She had no power. She had no ability to feed her family what she would have fed them otherwise. So that became the family tradition or the heritage, and it's not even real. It's a false paradigm that was either forced on her or was marketed to her from the mass media.
Yeah. Very interesting answer there. I mean, Indians will find it very relevant. The common messaging, Dr. Berry, that pre-diabetics is not dangerous. I'm mentioning diabetes here particularly because India has 101 million diabetics and another, I think, 136 million pre-diabetics. And as a metabolically unhealthy country, largely, people do think that pre-diabetics is not that dangerous. How true is it? And then we come, to the next part of the question. Please clarify.
Yeah, it's not true at all. It's not even a little bit true. It's false. But think about this, Ira. If I were a doctor who believed in a plant-based diet, who believed in a vegetarian diet or a vegan diet, if I believed that, then I would have to tell my patients, oh, prediabetes is not a big deal. Having a high fasting insulin level called hyperinsulinemia, those are not dangerous. I would have to say that because the majority of my patients would have prediabetes, wouldn't they? Just like we see in the Indian population. If you eat a diet full of grains and full of highly processed ground up grains and sugar and vegetable seed oils, you're going to have some degree of prediabetes. And so if I were a doctor who believed in my heart that a vegetarian diet was the best diet, I would have to discount prediabetes. I would have to say, oh, that's no big deal. Don't worry about that. That's just a bunch of foolishness. But when we actually look at the research, it's been proven very, very clearly that long before you develop type 2 diabetes, which is an A1C of 6.5 or higher, when you've got that A1C of 5.9 or 6.1, and your doctor's saying, oh, prediabetes is not dangerous, when you actually look at the research about prediabetes, it's been proven in multiple studies to be causing kidney damage, heart damage, brain damage, liver damage, fatty liver, fatty pancreas. All of these things are happening. But the human body is so strong and resilient that you may not have many symptoms. Even though you're pre-diabetic and you have hyperinsulinemia, you may feel relatively normal. And you may have that little belly pooch, but you may be very thin otherwise. And so that's the problem, is it's been shown clearly in the research that permanent damage is being done when you're pre-diabetic. When your A1C gets above 5.6, you are doing permanent damage to every little artery in your body. And the tiny arteries and the arterioles and the capillary beds, that's what feeds every cell, every tissue, every organ in your body. That's what feeds it. And if you're damaging those tiny blood vessels, that's damage, and that's going to build up. And at some point, you're going to have a severe complication. Obviously, you're going to eventually develop type 2 diabetes. But along the way, long before, maybe 10 years before you develop type 2 diabetes, you're doing damage to your body by eating a diet that's full of grains and full of fruits and fruit juices. That's doing permanent damage to your body. And that's very clear in the medical literature that prediabetes is doing damage. It is not benign. It is not innocuous. It is not safe to be a pre-diabetic.
I think somewhere people have also settled with the fact that diabetes is genetic, and they don't give much consideration to what we are eating and also the immediate factors that may trigger the condition. So largely they get away with the doctor telling them, or the people around them telling them that diabetes is genetic. So they're kind of okay with that, and that's how it doesn't become such an alarming situation, pre-diabetes. Could you just shed a bit of light on that? Is it genetic or how is it?
Yeah.
What
So there is a small genetic predisposition to develop prediabetes or type 2 diabetes. That's absolutely true. That probably accounts for somewhere between 1 and 5% of your risk of developing prediabetes or type 2 diabetes. But the 80% cause, what causes 85% of prediabetes and type 2 diabetes? It's the food. It's the grains, it's the beans, it's the fruits, it's the fruit juices, it's the desserts, it's the snacks. That's what's causing it. And so if you have a 1% risk factor for developing prediabetes or type 2 diabetes genetically, and you eat a very low carbohydrate diet or a keto diet or a ketovore or a carnivore diet, you will never develop type 2 diabetes regardless of what your genetics are. And if you start eating a keto, ketovore, or carnivore diet while you are a type 2 diabetic, you will reverse your type 2 diabetes and you'll have a normal A1C. So yes, there is a very small genetic component to prediabetes and type 2 diabetes. Some people develop it easier than others. I'm one of those people. I develop prediabetes very easily if I eat too many carbohydrates. But as long as I keep my carbohydrate intake low enough for my personal physiology, my genetics, potentially my gut microbiome, my A1C is beautiful. My fasting insulin is beautiful. I don't have prediabetes anymore. I reversed it, and I'm able to keep it reversed for the rest of my life by eating low carbohydrate enough for me. And that's what the people have to understand is prediabetes is dangerous. Everybody knows type 2 diabetes is dangerous. You might have a little genetic predisposition, but that is not your genetic destiny. You're not destined for that. You can absolutely control that small genetic risk by eating a proper human diet, somewhere on the proper human diet spectrum, and you will never develop prediabetes, and you will never develop type 2 diabetes. And if you already have it, you will reverse it back to a normal A1C and back to a normal fasting insulin.
I have so many questions, Dr. Berry. I think I'll keep you for the next session as well, if you agree. But quickly, I mean, I have so much to ask you. Maybe we can just kind of hurry up a bit.
Yep.
Your views on veganism. Your views on veganism.
Veganism.
Yes.
I think that when somebody's eating a vegan diet, I call that the first step to a carnivore diet. The going vegan is the first step towards adopting a proper human diet because it means you're thinking about food. You're making choices, because the average person in the United States definitely, and probably many people in India, don't even think about their diet. They just grab whatever's the quickest, whatever's the cheapest. They're busy. They're trying to be successful. They're trying to grow a business, or they're trying to support their family. They don't think about food. They just eat whatever the corporation puts in front of them. That's the cheapest, right? But when you make the leap and say, no, I'm going to be a vegan, I'm going to be a vegetarian, at least you're thinking about food. And I think that's the first step, is actually caring about food and thinking about the food you put in your body. And so I love it when somebody goes vegan. I love it when they adopt a vegetarian diet, because I know now they're thinking about food. And if you're thinking about food, then you're going to start looking for patterns. Oh man, when I eat this, I have severe bloating. When I eat this, I have gut problems. When I eat this, my arthritis flares up. When I eat this, I get acne, or I get my eczema flares up, or my psoriasis flares up. And so then they're like, well, maybe I shouldn't eat that. And that's good, because you're thinking about food. And that's what I want everyone to do, is I want you to think about every bite of food before you put it in your mouth. And so invariably, when somebody adopts a vegan diet, not for religious reasons, but because they currently believe that's the healthiest way to eat, at some point, either a few months in or a few years in, they're going to develop vitamin and mineral deficiencies. They're going to realize, I'm not getting enough real animal protein in my diet that's healthy for me. I'm not getting enough healthy fatty acids in my diet. I'm not getting enough DHA, EPA, the omega-3 fatty acids. I'm not getting enough of that. I need to add more. And so many vegans, what do they go to? They start taking supplements. But my question to you would be, if there is a food that contains that vitamin or mineral or fatty acid or amino acid, and it's very uninflammatory, and it's a food that your ancestors 300 to 500 generations ago, they ate it every chance they got, then why wouldn't you just eat the food instead of taking a handful of supplements?
Right.
And that's the final inner conversation that happens for somebody who says, yeah, that was foolishness. I'm going to start eating either a ketogenic diet or a ketovore diet or a carnivore diet, because there's really no reason not to, once I start really thinking about this and once I start listening to my body's feedback.
Okay, Dr. Berry, what are your views on this is for people, India, we hear this a lot. Red meat is bad for you. Eggs are bad for you, especially with yolk. Saturated fats are bad for you. So anything that happens to you, like in my case, membranous nephropathy, the first thing that I was told was to go low on protein. In fact, there was no dietary protocol given, and that was amazing because I was draining protein from my body and there was no dietary protocol on protein given. So to all those people who say saturated fats are bad, eggs are bad, yolks are bad, red meat is bad, please give out a message and so that they can understand this better.
Yeah, there's so many people out there, so many doctors and dietitians saying those sorts of things. But the problem is there's no research that backs that up. The only research that they can point to is epidemiological research that uses food frequency questionnaires as the data point that's the data they collect. And that kind of research is known in the scientific community that it cannot prove causation. It can only show a possible association. And in many cases, like the World Health Organization says that eating red meat causes cancer. All of the research they use to support that opinion is observational epidemiological research. There's not one randomized controlled trial. There's not one robust research study that they can point to that says, see, when you add more red meat to someone's diet, their risk of this, that, or the other goes up. The same goes with type 2 diabetes. There are so many doctors that say, oh, saturated fat and red meat will increase your risk of developing diabetes. Well, there's a new study out that shows that's the randomized controlled trial meta-analysis shows that there's no association. And this is a randomized controlled trial.
Right.
It says there's no association between eating red meat or fatty red meat or saturated fat and diabetes, none at all. But in the news media right now, I just made a YouTube video about this on my channel. There's this study that every newspaper is talking about, oh, red meat causes diabetes. But when I looked at the research, and I talk about this on my YouTube video, it's an observational study. It's a prospective cohort. And go ahead.
Yeah, sorry to interrupt you. I think you recently tweeted about the Harvard study, I think just last week or this week.
Yep.
And tell us how. I mean, coming from Harvard, this is amazing.
Right. And so many people look up to Harvard. They look up to the American Diabetes Association. And I think there was a time in the past when that was a rational thing to do. They were the experts. They were the smartest people in the room. You should look up to them. But when you actually look at the funding of the Harvard School of Public Health, when you look at the funding for the American Diabetes Association or the American Heart Association, these people have been co-opted. They get millions of dollars every year from the big food corporations. They get millions of dollars in donations from the big pharmaceutical corporations, right? And they call it donations. But if somebody were giving you millions of dollars a year and they said, hey, we need you to, have a study that says this, that, or the other, you might be liable to put out a study like that. And like the Harvard study, for example, that I tweeted about, that you mentioned, that I also have a YouTube video about. When you look at the hazard ratio that they found, it's foolishness. It's less than 2, which in any scientist knows that's background noise. That's scatter. That's not even that doesn't even show a possible association. That's just random noise in the study. And good scientists don't even look at a hazard ratio of 1.4. They would ignore that and say, well, that study didn't find anything at all. I'm not even going to publish it. But the Harvard School of Public Health not only published it, but they've been proclaiming from the rooftops that red meat causes diabetes. Here's a new study. But when you dig into that study, it's complete and utter rubbish. And so Walter Willett, who's one of the professors at the Harvard School of Public Health, he's a vegan, and he believes in a vegan diet, and he promotes a vegan diet. And I'll bet you money he has investments in plant-based companies. And I know that him and his department get millions of dollars of research grants every year from the big corporations. And therefore, he believes that a vegan diet is the most healthy diet. But I don't think that the average person like me and you and all the viewers, I don't think we can trust the Harvard School of Public Health anymore. I don't think we can trust the American Diabetes Association or the American Heart Association any longer. I think that they've effectively been bought off. They've been paid off. They've been bribed to say certain things, and they've been bribed to not say other things. And I think that's a big problem. And it's not the average person's fault. It's not your fault that the Harvard School of Public Health is saying these things, but it is your problem. And if you're eating according to the American Diabetes Association, American Heart Association, or the Harvard School of Public Health, and you've got prediabetes, and you've got TOFI, thin on the outside, fat on the inside, you've got visceral fats, you've got chronic inflammation, you're the one suffering. They're not suffering. They're making millions of dollars, and you're the one suffering. So it's you who's going to have to make the decision. Should I continue to follow these people who I thought were honest and earnest and very intelligent, or should I try 90 days of keto or 90 days of carnivore just to see if Dr. Berry's right? It's just 90 days. What's the worst that could happen? So they would say, oh, it's going to damage your heart or cause cancer or this, that, or the other. But there are hundreds of thousands of people right now all around the world eating a carnivore diet every day. And if red meat was truly as toxic as they say it is, as dangerous as they say it is, then thousands of people every day in the carnivore community would be developing type 2 diabetes, wouldn't they? They'd be developing colon cancer, bowel cancer. They'd be developing heart disease. Every day there would just be thousands of carnivores falling off the map because they died of a heart attack or they had kidney failure from the type 2 diabetes. But what we see invariably in the carnivore community is people's A1Cs going back to normal. Their type 2 diabetes going completely away. We see in the carnivore community every day that their coronary artery calcium score or their CT angiogram of their heart arteries improving. If you recheck it every year, it gets better and better and better. We see kidney health. We see creatinine levels and estimated glomerular filtration rates, EGFRs, getting better on a carnivore diet, not worse. So there's a huge disconnect here. And I think it's going to be ultimately up to the people to decide what diet am I going to try to improve my health. Because right now we see with the epidemics of prediabetes and type 2 diabetes, and in the United States of obesity, of high blood pressure, we see all these things of chronic inflammation in the joints, in the gut, in the skin, the chronic mental health epidemics. What we're being recommended right now, what's being advertised to us is not working. In fact, it's dangerous. It's dangerous for you and for your family. And when you turn away from the mainstream narrative, when you turn away from the corporate paradigm of eat lots of grains and beans and drink lots of fruit juice and eat lots of desserts and snacks, when you stop all that and just eat a proper human diet, your health starts to improve immediately. Then you'll be convinced. And then you'll say, oh, okay, I get it now. It's not all about health. It's all about the money.
Dr. Berry, we have just 5 minutes left, and I have so much to ask you. Let me just come to a very critical question. In India, people usually consume very little protein, and as they age, the popular belief is that you should bring down the protein consumption. It is very low. And this, when you age, you further stop taking protein. How critical is protein as you age?
Protein is one of the most vital nutrients you can consume. And actually, as you get older, you should eat more protein, not less. and you should be eating the most ancestrally appropriate form of protein, right? And so we've been Homo sapiens sapien for thousands and thousands of generations. We've been eating meat, we've been eating seafood, we've been eating eggs for all of those generations. And so as you get older, if you want to remain vigorous, if you want to remain active, if you want to keep your bones strong and you want to keep your muscles strong, then you need to be eating a proper human diet with plenty of animal protein in it. Now, if you're ready to be an invalid, if you're ready to go to the nursing home, if you're ready to be the grandmother or the grandfather that none of the grandkids want to go visit because all you do is sit in your chair and complain, then eat a low protein diet. That'll get you there. But if you'd like to be that grandmother or that grandfather that the grandkids can't wait to go see because you're out in the backyard kicking the football around with them and you're out wrestling with them and playing with them and going on hikes with them, then you better eat protein and you better not be afraid of it. And a large percentage of the protein you eat every day better come from eggs and from the flesh of animals, because that's the protein that is the most absorbed, the most usable, the most assimilated in the human body. You want to keep your bones strong. You don't want to develop osteoporosis. You want to keep your muscles strong. You don't want to develop sarcopenia. You don't want to be in a nursing home having some stranger making minimum wage, taking care of your personal hygiene. You want to be able to take care of your own activities of daily living. And the way you do that is by eating lots of animal fat and animal protein, keeping your bones strong, keeping your muscles strong, keeping your mind strong, so you can take care of yourself and also take care of your family as well.
And in one line, Dr. Berry, what would your message be for India especially?
Stop believing the lie. Grains and beans are not health foods. They are not optimization foods. They are starvation foods. They are fallback foods. They are the food that a colonial slave driver convinced your great grandmother that's all she had access to. And so rather than her say, well, I'm feeding my family this inferior slave diet, it feels better and sounds better to say, oh, this is our heritage. This is our culture. It's not. If you go back even 300 generations, no one in your family ate grains and beans. They ate meat and eggs and seafood and some plants, of course, yes. But the grains and beans played no role in their diet whatsoever, regardless of your heritage, regardless of your family tradition, regardless of what your religious leader taught you. It's not true. It's very clear in the anthropology and the archaeology.
Thank you so much, Dr. Berry. I can never, have enough time to ask questions from you. Totally flawed, totally better advice, totally, in the know of so many things now that you've clarified for the benefit of our viewers, the common myths that you've busted, the things that plague India, the belief systems that we have that stop us from following the proper human diet, be it religious or whatever. Thank you so much for coming. Thank you so much for speaking to us. It was a wonderful session with you, Dr. Berry.
It was a pleasure and an honor. Thank you so much for having me.